Good morning. Can you hear me?
Hello?
Hello.
Testing.
Can you hear me?
Oh, yes. Hi, how are
Oh,
you?
fabulous. I'm good. How are you?
I am well.
I've just started
Um,
clinic.
yeah, I think I had it plugged in at the wrong area, but we got it working.
Good. Okay.
Um, so my name is Grace Rowan. I'm the GA for IHEC, and we're looking to start around like 11, kind of say hi to everyone around 10:55. Does that sound okay?
That sounds great.
Okay, perfect. I'll just do like an opening, kind of go over the housekeeping, and then do a bio for you, and then I'll hand it over.
Okay, fabulous. And can you see my screen? No.
Um, oh, right. Let me see. How do you share this? 1 second.
Okay.
Okay, now I see your screen.
Okay. Is that
Oh,
better?
perfect.
Okay, cool. Nobody needs to see all the things I have on my toolbar, right?
Okay. Okay, looking good. Thank you.
All right, awesome. Thank you very much.
Hello, everyone, and welcome to today's webinar, Prescription Drug Misuse Prevention Strategies for You. My name is Grace Rowan, one of the graduate assistants at IHEC, and I'll be your moderator. I am assisting Aisha, the Assistant Director for Illinois Higher Education Center for Alcohol, Other Drug, and Violence Prevention, and I'm very excited to be hosting today's event. Before I hand over the microphone, I have a few housekeeping items to cover about today's webinar and the GoToWebinar platform. For those of you new to using GoToWebinar, you will see the control panel on the right of your screen. This is where you'll find the question box that you can type and submit to. All attendees can feel free to ask questions during today's program, and we will also have time at the end. So without further ado, I'd like to introduce today's speaker, Tessa Miracle. Tessa Miracle, PhDC, is the evaluator for Ohio's Strategic Prevention Framework for Prescription Drug Abuse. As Ohio's SPF RX evaluator, she coordinates a statewide work group and aids in the design, implementation, and analysis of evaluation activities. She has served Ohio's Miami Value as a leader through facilitating and integrating resources and prevention efforts in areas such as marijuana, opiates, alcohol, HIV, AIDS, sexual violence, integrated behavioral health, and mental health awareness. She has experience using strategic prevention framework activities to guide county coalitions, multi-college initiatives, and regional work groups. She's also a doctoral candidate at the University of Cincinnati studying health education. Tessa?
And good morning, everyone. Thank you so much for the introduction. And I want to say a special thank you to our organizers. I'm so excited to bring our strategies and resources to you today. So let's get started. So today, our main topics we are going to discuss are the effective strategies to prevent prescription drug misuse, how prescription drug disposal can support your comprehensive prevention efforts, and any opportunities for collaboration. But before I get started, I'd like to get a handle on who we have with us. So could you tell me, first off, how is prescription drug misuse impacting your campuses or your students? And you're welcome to use the chat right now. I understand everyone is sort of is muted at the moment. So if you're able to share any information about, how this is impacting your campus or your students, and what strategies you are currently using to prevent prescription drug misuse at your institution or organization. So I see some folks talking. We'll give you a couple minutes to get those messages in. So I know that prescription drug misuse, and I will sort of read those off as they come in, and we'll facilitate more discussion around that. So prescription drug misuse has some risk factors. And before I got started today, I really wanted to take a look at individual risk factors for prescription drug misuse, just in case we had folks who hadn't worked in this area or had not seen this as an issue on their campus. The demographics of prescription drug use indicated that users are typically Caucasian or Latino. They have a lower socioeconomic status and range in age between 18 and 25, which is why it was so insightful for our organizers to bring such a diverse group of individuals together so we can really make sure we're targeting this high-risk age group. As we look across youth survey data that was collected across the state of Illinois, it also appears that prescription drug misuse occurs more frequently in rural areas. So our young adults who are coming to stay with us and receive their education, coming from a rural area may have a unique risk factor. When surveyed about perception of ease of access, older youth tended to perceive that prescription drugs were easier to access compared to their younger counterparts. And the source for prescription drugs varied by our age group of our young adults. Eighth grade youth reported higher access from parents, while 12th grade students, who are those students who are just about to join us on campus, reported higher access from someone other than their parents, purchasing the medication for them or sharing a prescription. And then when we look at our college population, the vast majority of college students reported getting access to prescription medications from legitimate prescriptions that they then misused, with the exception of stimulants. which they reported from getting from friends at school. So prescription drug misuse, often we think primarily of opioid misuse, but what is interesting about our college age young adults is that misuse often includes stimulants as well as opiates. Now, to take it one step further down the pipeline, I really wanted to look at overdose drug related deaths. So, because of the link between prescription drug misuse and eventual overdose. So, thanks to the Illinois Department of Public Health, we were able to access some data and do a quick review. What was interesting is the majority of overdoses of medications involve prescription drugs, or overdose deaths involve prescription drugs, excuse me. According to SAMHSA, the link between prescription drug misuse and overdose is even stronger than we initially thought. 4 out of 5 people who started using heroin in the past year had previously misused pain relievers in a non-medical fashion. And additionally, more than 70% of people using opioid analgesics for non-medical reasons get them from family and friends. So this is why it is so important we focus on these universal prevention strategies and we really fight our way upstream. I do get some pushback sometimes when my research and my career is so focused on prevention that I get the question a lot, why focus on prevention? So prevention approaches focus on helping people develop the knowledge, attitudes, and skills they need to make good choices or change harmful behaviors. And what a better time to help someone develop these skills than while they are with you receiving their education. Additionally, mental illness and substance use disorders are among the top conditions that cause disability in the United States. So we want to ensure that individuals are achieving optimal health while they're with us. It isn't a surprise to hear that prescription drug misuse happens on college campuses and university campuses. As I was reviewing our data, I found data from the College Prescription Drug Study from The Ohio State University, which includes information from 8 campuses nationwide. Their data suggests that 1% of students have misused prescription stimulants, 5% have misused prescription pain relievers or prescription sedatives within the last year. Because the problems arising from prescription drug misuse don't look the same as problems related to marijuana use or alcohol misuse, this may be tougher for universities to recognize the scope of the issue. Additionally, the points of access look different for prescription medication misuse. Oftentimes, as we discussed already, students are accessing legitimate prescriptions but using them for non-medical reasons. Also, because this is a newer public health issue, it may be difficult to identify prevention strategies that are effective and culturally competent for your university or college. For these reasons, we're going to discuss relevant data, prevention strategies, and community engagement resources for you to utilize on your campus. So let's start talking about why we're focusing on prevention. To make sure that we are all using the same framework, I wanted to share the IOM continuum of care with you, just so we're all on the same. We're on the same page. Often when I talk about prevention, folks kind of think of overdose prevention. So I want to make sure that we are talking about the same area. So promotion, if we are looking at the left side of your wheel here, promotion is where we're really talking about our awareness activities. So our flyers, our passive information that's getting shared. And then today we're also going to spend some time on the universal strategies and a little bit about indicated prevention strategies and selective. So we're really focusing in that blue area of the wheel. Substance use and mental disorders can make daily activities difficult and impair a person's ability to work or interact with their family and fulfill other major life functions. Preventing mental or substance use disorders and related problems is critical to our behavioral and physical health. So for these reasons, we're going to focus on prevention today. The very first thing I want to talk about is some promotion resources that are available to you. Thanks to the Substance Abuse and Mental Health Services Administration. So I have linked the website for you, and these will be available to you after the presentation. I'll share with our organizers so you can just click one link and go. So The first resource I want to bring to you is a focus on safe storage of prescription medications. So this is from the Know the Options, Get the Facts series from SAMHSA. Um, this was designed for a broad audience. It's available as a free resource, and I would encourage people to cite the resources and create branded health materials for use. So, looking at this, there's a lot of information for us, but you could take the information about promoting the awareness of safe storage of medications and put that into a tweet, put it into your any of your health information or your handouts that you provide for students as well. Similarly, SAMHSA also offers information for you, an information handout on prescription pain medication safe disposal. So this is designed for a very broad audience. Looking at the flyer, immediately you see that it references very young children, that this may not be a message that your college students would latch onto. But again, it provides information for a broad audience, and you could cite these resources and take the information and create your own campaign about safe medication disposal, because we do know that safe medication disposal is a universal prevention strategy that works across the continuum of life. So under our promotion and awareness materials from SAMHSA, we also have a handout that would be great for you to use with your health services center. So prescription pain medications, know my medications. This handout, designed for broad audience and is available as a free download, represents a unique educational opportunity for students when they're interacting with their healthcare professionals to get to know their medications. So especially as we have young adults coming to us who may have some health needs that have been unmet before they're able to access a prescription, we want to make sure that they know what the medication is, how much they should be taking, any possible side effects, and what to do with that leftover medication. And this handout would be easy for you to rebrand with your institution's information, their logo, maybe your mascot, so students have something to take with them as they leave. Also, to reinforce any education provided by either your health center or physicians that students see, the medication agreement presents a pledge for students to ensure that they are using the medication appropriately, and it really supports that conversation with the provider. This does meet a broad audience, so I know we have some folks joining us who may be from a non-traditional campus. So you have students who don't live on campus or older adult students. This is something that you could also partner with your area medical providers and just make sure they have access to as well. So the prevention strategies I really want to talk about are education and environmental. So the very first thing I want to talk to you about is an educational campaign that I'm sure many of you have experience with. So the very first educational campaign I want to talk to you about very briefly, just because I know so many of you probably have experience, is Generation RX. So Generation RX was designed to educate college students towards safe medication practices for life. This focuses on specific issues relating to opioid and stimulant medications, as well as key general guidelines for safe medication taking practices. While Generation RX has toolkits for the elementary age students, for teens, college students, adults, older adults, patients, and one even for the workplace, today I just want to briefly talk to you about the toolkit for college age students. So in this toolkit, that is available for free as an online download, all the resources to empower facilitators are present. So there are presentations, talking points, and even activities. So the facilitator's guide can guide any of your students, or if you have staff who are interested in delivering this sort of information. There's an introductory letter that you can send home and just add your university's information and logo to, so students are aware of it. There's a handout, there are flyers, there are posters, and they even have activities for live programming. There are a few preliminary studies on this educational program, and at this moment it is evidence informed, and it is working its way to being evidence based. Because this is such a new public health issue, that is one of the challenges in prescription drug misuse prevention is many of the strategies at this time are evidence informed due to the newness of this issue. A strategy I really want to spend a lot of time talking about today because the environmental work is a strategy that is easier to invest in. You don't have to dedicate, full staff time to providing education, and often supports our camaraderie and our relationships with not only within our organizations, but with our community. So environmental prevention strategies are something that I want to spend a little bit of time on today. So prevention strategies include policies and programs and practices that promote well-being of people and reduce the consumption, as well as the problems associated with alcohol, tobacco, and other drugs. Environmental strategies are unique in that they require a comprehensive community prevention process to guide their selection and implementation to make sure you are selecting the correct strategy for your campus community or for your broader community, depending on what type of campus you're coming from. And for those of us who are partnering with community organizations and initiatives, we remember that community doesn't have to stop at our campus lines. Community can include, just our campus if we're sort of a little more insulated, or it can go broader than that. So let's talk more about these population-based interventions that change the context in which individuals make decisions. So one of the reasons that I really love environmental prevention strategies is because of their level of effectiveness. So they reduce collective risk, they reach entire populations, and they create lasting change in community norms and systems. One of the benefits that I think is really important for us to remember is in effective environmental strategies don't require that we identify people as, quote, at risk, end quote. They reduce that risk of possibly stigmatizing an individual or ostracizing someone. So when we focus on environmental work, we're just reducing collective risk for everyone. While this is a strategy that does require collaboration, the long-term outcomes do take a little bit longer to measure, but can be longer lasting. So just to go back to, I do get a lot of pushback about why should we focus on prevention? Why are we talking about prescription medication storage and prescription medication disposal when people need treatment? Well, it's for these reasons. I found a study to share with you from Rhode Island. The study has not been replicated in other states, but what I thought was really interesting is the majority of students had reported never storing medications in a locked location or improper medication disposal, and almost a third reported medication sharing. These represent a unique risk. So they represent the risk not only that we're leaving medications for other people to access without our knowledge, we're also endangering the environment by improperly disposing of medications. And then almost a third of us are sharing our medication, which not only puts our friends or our loved ones at risk of, some sort of allergic reaction or anything like that, it also puts people at risk for developing an addiction or misusing a medication in a non-medical form. So the real reason we're focusing so far upstream is really to stop this train before it becomes an emergency. So in prescription drug safety, you've heard me talk about medication storage and medication disposal. And what we're really doing there is we are enhancing access to a prevention strategy, and we are reducing barriers to medication safety. So making drug take-back programs even more accessible than they currently are is an effective way to reduce access to non-necessary medications. Regularly promoting their use at medical visits in the student health center, clinics, or retail stores will serve to reduce barriers. Also, making sure that individuals prevent access to both prescription and over-the-counter medications when guests are in their homes is another way to prevent unnecessary access to medication. Medication storage, the safest way to store our medications is in a secure private location. Now, for some, a secure private location may mean a medication lockbox or a pouch, such as the one pictured here. For others, a secure and private location can mean another area in our home. It may be a locked jewelry box. This really depends on the individual's situation. We should always ensure that medications are stored in a dry and cool location that is out of sight of visitors, both known and unknown. You can use the SAMHSA resources I referenced earlier to reinforce this message. When students are living in high density housing, such as our dorms or our off-campus housing in those apartment buildings, this is great for students to commune and get to know each other and have a positive social interaction. But it also represents a unique risk in that we often have people in our living quarters that we don't know. So for these reasons, in a dorm situation, a lock medication pouch or lock medication storage may be a great strategy for your university to invest in or to partner with an area coalition to provide. Now, for medications that are unneeded any longer, so maybe something's expired, maybe it didn't work for me, maybe I had a root canal, a year ago, and I ended up not using that full prescription. That represents a unique risk because we do know that the majority of folks who entered treatment for opioid use disorder did obtain medications from family or friends. My unused medication may put someone I care about or anyone in general at risk. Permanent prescription disposal locations provide the most environmentally sound way to dispose of medications. So the big thank you to Walgreens and CVS, both of which have invested in providing permanent prescription disposal boxes in every store location. CVS has opened all of theirs as of January 1st, 2020, and Walgreens is working on incremental rollout. This is a great opportunity to dispose of unnecessary medications. But if your students don't know about this, number one, if they don't know about the reason to dispose of medications and its significant importance, but also if they don't know the opportunity exists, they may not utilize these resources. Also, as you're looking for permanent prescription disposal locations, DEA.gov has a full list of DEA take-back sites throughout the nation. Also, in the state of Ohio, and I know many other states have, including Illinois, have partnered with Google Maps. If you have a student or yourself, open the Google Maps app and type in RX disposal or prescription disposal, locations around you will pop up and you'll get turn-by-turn directions. Now, I know that a permanent prescription disposal location is not accessible for everyone. Many of these locations are located within a police department, which some of our students and some of our colleagues may not be comfortable, going into the police department to access that location. But there are other opportunities. So the prescription disposal pouches that I'm referencing here, there are a few different varieties out there. I know in our grant work in the state of Ohio, we use the doTERRA bag. Prescription disposal pouches are a unique opportunity that allow individuals to dispose of prescription medication in the privacy of their own home. All of these bags contain a proprietary blend of carbon and other chemicals that permanently bind to and deactivate medications and render them useless. The disposal pouches allow an individual to throw the combination of water, medication, and the disposal pouch into their garbage without concern for a pet accessing medication and suffering ill effects. Now, I know I've been focusing primarily on very early prevention and promotion, but I did want to remind folks that we may have some individuals as we start in this work and we start sharing awareness messaging and increasing that awareness on our campus, that we may have some individuals who have experimented with medications or maybe have developed an addiction. So for those needs, a screening, brief intervention, and referral to treatment, also known as SBIRT, is an evidence-based strategy for you to use within your health centers to ensure that you are not leaving anyone out of your comprehensive approach. So as we approach this work, I had 3 questions for myself. What can I do? What can you do? And what can we do? So what can the singular I do as a prevention professional or as a health promotion professional? I can pledge to use medication safely. I can talk with my family, my friends, and even my students about safely storing and disposing of medications and really ensuring that I am part of changing that norm around medication storage and disposal. I can also support any campus-wide prevention strategies, whether that is partnering with a DEA Take-Back event, which I neglected to remind you all earlier. The next DEA Take-Back Day is April 25th, 2020, and you can reach out directly to the DEA to ensure that one of those disposal opportunities is close to you. What can you do? In your role, you can identify prevention champions within your institution, and they may be unexpected partners. So you may find that your basketball coach is really passionate about health and wants, their students and their players to get involved with community work and changing their campus community. You can support educational campaigns, and you can identify medication disposal opportunities on or near your campus and promote their existence. Because we have found, at least in the state of Ohio, the majority of adults do not know where to access safe medication disposal opportunities. What can we do together? So we can encourage the use of medication drop boxes and other medication disposal resources. We can support comprehensive, collaborative, and educational campaigns. And we can change medication safety norms while we're collaborating with local prevention efforts. I do want to remind folks that as I was preparing for this webinar, I took a look at previous webinar topics, and I saw that the strategic prevention framework was highlighted as a previous webinar. I would encourage you, if you have not watched that webinar, to go back and watch the strategic prevention framework webinar to learn more about the collaborative approach, and then take the information you learned today about medication safety and infuse that into your planning process to ensure that you are offering a sustainable and culturally competent prevention approach on your campus. Because this is such a new territory for our universities and for our public health professionals to tackle, I wanted to offer some tips for success before I open up the floor for questions and for discussion. So engage your partners. Allied organizations, particularly those with large memberships of the target audience, can fill gaps and strengthen weak areas of your strategy. So if you have a student-led organization or your student organizations around campus, maybe a great partner for you in this work. It may already fit with one of their current projects they're working on, and reaching out and engaging those student groups is a great way to help change those norms. Gaining support for your strategy, what better way than using your students, working with them. So launching your prevention activities in stages while building capacity allows you to not only gain support, but also make sure that everyone is ready and equipped for your strategies to be carried out. We're going to maximize participation of our target audience. We can offer incentives. That could be fun, that can be prizes, that can be food, that could be whatever would engage your students and their parents in your entire campus community. It's not always some grand incentive. Sometimes it's something as simple as candy on your table to get them to come over and start that discussion. And reducing barriers. So I think the reducing barriers is really important when it comes to medication safety. So we talked a bit about promoting awareness of medication safety strategies, but also we have to remember that our students may not have transportation to those permanent prescription disposal locations. So looking at, is a prescription disposal pouch more reasonable for my campus and for my students to use? Is it an opportunity for us to partner with the DEA and host our own DEA Take Back Day on our campus as part of reducing barriers and making sure that we're keeping a friendly climate around our strategies? Trying different versions of our strategies is also a great tip for success. I know originally when we started on our grant in 2017, we thought that we would be offering, prescription or just promoting permanent prescription disposal locations. And then we realized that issues with transportation, discomfort carrying medications, and stigma really limited the engagement in the strategy. So that's when we started looking for other opportunities. And we've really found the National Guard and the Counter Drug Task Force were wonderful partners to help us offer more DEA take back sites for, those DEA take back days that happen twice a year. Also, that's when we were able to find the prescription disposal pouches that we've had great success with. Long-term approaches and maintaining support are vital to our success. So, just keeping that open dialogue with our progress and any issues and resources that we need, especially with our campus leadership, can ensure ongoing success. And as always, I know working on a campus, you are all very aware about being flexible and considering tuning up our strategy. And that means we may drop or add activities or shift our focus. So those are my few tips for success, but I have a few discussion questions for you before we move on to our questions. So I'd like to go back to our poll earlier. So can anyone share if their campus is working on prescription drug misuse prevention, and what strategies are you using? Okay. So we have some folks who are seeing stimulants misuse, which, in the Ohio data, we definitely see that as well. Okay. An online course. Interesting. Yeah. So some of our folks who have joined us on the call today, so for those of you who are implementing strategies, some of you have a course that is offered but not mandated. You have awareness posters. You have things like that. Just sort of that ground level work, and it sounds like you're really poised to take it to the next level. My next question for you guys is, as you're looking to take it to that next level, how many of you are partnering with community-based initiatives or programs, if that's appropriate for your community? So we're hearing feedback. I like the idea of an online course. The individual with the online course, it may be great for your partners here on the call to know a little bit more about your online course. So I don't know if that's something you can share, if that's something proprietary, but it looks like we've got a few comments that is of interest to folks. Great. So it looks like some pharmacies are offering disposal options. What a great way to sort of provide that education and reinforce as people are, attending the pharmacy, picking up a medication, or just doing their general shopping. I know around, when I was in college, the pharmacy was sort of the catch-all. You went there to pick up things you needed unless you needed to get further out of town and go to a real store. Okay. Well, it sounds like you guys are doing some really great work. I hope the strategies that I presented can help you take that to the next level. I'd like to open it up a little bit for questions. So what questions do you have for me as you are progressing? So for those of you who are interested, sorry, as a side note, in the online course, it was EverFi's online course that was being used. So, what questions do you have as you go back to your role and you're thinking about promoting medication safety on your campus? What questions do you have for me? How can these things be adapted to work sites is our first question. Well, I think that would depend on the size of your work site, but I think you could definitely take the resources that were offered so that those awareness flyers, I think you could definitely take those and brand them to your work site. I think you could also include it. I've seen some work sites add this information into any onboarding that employees receive as they are brought into a new position. When you fill out your health insurance information and when you come in for that day where you're filling everything out and you get your handbook, you could definitely add these flyers in there. I think also, promoting DEA Take Back Day within your organization would be a great way to remind folks because that is set up twice a year. So the next one is April 25th, 2020. Reminding any employees that that's coming up. And then I think also encouraging employees to participate in community-based health initiatives could be a great way to not only make sure your employees are receiving the information, but they're engaged in the community because we know that there are probably many health issues impacting the community, so it can serve as a reinforcer. Oh, we gotta thank you. Thank you for joining. Are there any additional questions for me? We'll leave it open for a little while longer. Well, I want to thank you all for all of your attention, and I'd like to hand it back to our organizers and see if they have any questions for me as well.
Thank you, Tessa, and thank you everyone for attending today's webinar. I do not have any further questions. Maybe just one more minute for anyone that has any last questions.
As they're typing away. Well, I do have my contact information on here. If anyone has any follow-up questions or any ideas or just any comments, please feel free to email me. That is my personal email address. I'm available anytime. And I really want to thank you all for your attention today. I want to thank our organizers for putting this together. What a great opportunity to connect with more folks around the nation. So if you have any questions, please let me know.
And I just wanted to say, please keep an eye out for an email from GoToWebinar that will come about an hour after the program. The email will have a link for you to fill out an evaluation. This evaluation will really help us with the planning of future events. Certificates will be issued within 7 to 10 business days for the webinar, and we will have the webinar available to view on the IHEC website. Thank you, Tessa, and thank you everyone that attended today.
Thank you. Have a great day.
Too.